A post-bariatric surgery exercise program should be gradual and tailored to the individual's specific needs and abilities. It's crucial to consult with a medical professional such as bariatric surgeon, physical therapist before starting any exercise program after bariatric surgery to ensure it's safe and appropriate for the patient's unique circumstances. Here's a general 12-week exercise program that can be adjusted based on an individual's conditions and progress. So weeks 1 through 4, we're going to establish mobility and stability. So week 1, what we'll do is begin with short 5-10 minute daily walks. Focus on mobility and gentle stretching. Week 2, we'll increase walk duration to about 15 to 20 minutes. Include light upper body stretching and mobility exercises. Continue to week 3 with daily walks and introduce basic body weight exercises such as squats or wall push-ups. Week 4, extended daily walks to 20 to 30 minutes. Introduce seated leg lifts, seated marches, and seated heel lifts for strengthening. Now continuing to week 5 and 8, building strength and endurance. Starting off week 5, we will increase walk duration to 30 to 40 minutes. Begin standing bodyweight exercises like squats and leg lifts. Week 6, continue doing daily walks and incorporate light resistance training with resistant bands and light dumbbells, maybe like 5 to 10 pounds, depending on how the patient feels. Focus on upper body exercises here. Week 7, we'll increase resistance or weight slightly, add more lower body exercises like lunges and step ups. Week 8, we will continue with resistance training, gradually increase the duration of walks to 40 to 50 minutes. Week 9 and 12, what we're gonna have here is progressing and adding variety. So we'll begin to incorporate more complex movements like planks, modified push-ups, and seated bicycle kicks in week 9. Week 10, we will continue resistance training, of course, focusing on a full body routine at this time. And we're gonna aim for 45 to 60 minute daily walks. Week 11, we're gonna start incorporating low impact cardiovascular activities such as swimming or stationary biking. This will try to do this 2 to 3 times a week. Week 12, we'll continue with exercise routine you've built, gradually increasing intensity, duration, and variety. We're going to assess the progress and consult a healthcare provider for further guidance after this, just to be sure. And just a little bit of the general guidelines here. Listen to your body. Don't push too hard. If there's any discomfort or pain, warning signs to stop, modify your exercise, stay hydrated, and consume a well-balanced diet as advised by your healthcare team. Prioritize flexibility and mobility exercises to prevent muscle stiffness and joint issues. Maintain consistency in your exercise routine, but be open to adjustments as needed. Gradually increase intensity, duration, and complexity of exercises to avoid overexertion and injuries. Always follow your surgeons and healthcare providers' recommendations, as the timeline and specific exercises can vary depending on the time of the bariatric surgery, individual health conditions, and the patient's progress. They can provide personalized guidelines to ensure a safe and effective recovery process. And just a quick going through my fake patient, John here. We'll do a SOAP note on him. I'll just go through that and list his goals, what the subjective, objective assessment and plan are. So we'll start off with his goal. Obviously, after bariatric surgery, your goal is to lose weight, but also keep a nutritious diet, become more active in your daily life, and learn how to run and swim. So John is 34-year-old male. He just got out of surgery 2 months ago and wants to start his journey to lose weight and get in the best shape of his life. John says he's already lost 15 pounds from the surgery, and he has been on a liquid diet, low carbs, for the time being. So we'll start with his objective here. Vitals, blood pressure is 135/97. It's a little high. Resting heart rate is also a little high at 79. Try to work continuously through these 12 weeks to get that down. As far as John, he looks, well nourished. He's already shown signs of weight loss. He's down 15 pounds, of course. BMI is around 28 to 30, so he still has a lot of work to come down from that high BMI. The wound from surgery is healing, which is great. And, he seems to have like a little bit of drag with his right leg. We'll work on getting that up to par with the left leg. That way there's no muscle imbalance. His assessment, he's been progressing with the weight loss since the last visit. No signs of infection or complications at the site. Nutritional status appears adequate, but could probably start eating solid foods again in about a month or two. His psychological as well is stable. That's very important. And our plan is we're just going to go through that 12-week program we went over at the beginning, continue with current dietary and exercise plan, consider additional counseling and support for dietary adherence, schedule the next follow-up appointment, and address any specific patient concerns or symptoms.